Hi, I'm Sandra King-Gill for Critical Connections Live. I'm here at the Thrive booth for the SCCM Save a Life event. I'm here with Heather Lee Bailey, who's the chair for this event, and also her esteemed colleagues, Vinay Nadkarni and Amy Zirba. Heather Lee, I know that today is the first public service event that SCCM has offered. I was wondering if you could tell me what the catalyst was for this program.
Certainly, Sandra. This has been a long standing thought process with the leadership of the Society. We've really wanted to be able to give back to the local communities because we come to these congresses, we have a wonderful time, wonderful education, and it's so important, we think, to give back to the local community. And so this has been in the planning for several years now, but it's only since we've come to the city of San Antonio and had the wonderful Texas hospitality and the buy-in from the city, the convention center, that we've been able to put on this event.
Great. As I was walking through, I noticed the CPR training that was ongoing. I was wondering if you could tell me a little bit more about that activity.
Yes, so the hands-only CPR is the main focus of this event, is to teach the bystander what to do in an emergency. The problem is so many people just don't know what to do, and those first few minutes are absolutely critical. So we have both teaching hands-only CPR to bystanders so that they are comfortable with what to do and how to do it, and then they move on to the AED station, which is how to use the defibrillators so that they are comfortable doing that event as well, because as we know, time is heart and brain, so they need to do immediate bystander CPR and, if needed, defibrillation to help save a life.
So I know CPR training is near and dear to your heart. Could you tell me why that is?
So my family actually was very involved in volunteer first aid from the time that I was a young child. And I have been helping my parents teach CPR at our local first aid squad where I grew up since I was 6 years old. And I have helped my parents teach thousands of people in the state of New Jersey first aid and CPR. And so it is near and dear to my heart. You are absolutely correct. It is such an important thing to learn and know how to do.
And so that's important. It's never too young to learn, right?
Never too young to learn. We actually had children, toddler children out there who were working on learning how to do CPR. So absolutely never too young to learn. I was 7 when I got my first CPR card.
Right, that's great. That's fantastic. I noticed there's a lot of buzz for other activities that are occurring today. Could you tell me a little bit about those other activities?
Absolutely. We've had some wonderful partners here in the city of San Antonio. We have the military here teaching how to stop the bleed, which is bystander training for if you're unfortunately involved in a mass casualty event, which is so common that we hear almost on a daily event. Mass casualty events that are happening in schools, at public events. But this is what you can do if you are ever faced in that situation of how you can save a life. Early on in trauma, the first few minutes again are critical, and one of the major causes of death is hemorrhage and bleeding to death. So being able to stop the bleed, as is the name, is an important thing. We also have a local college who is doing healthcare screenings, blood pressure checks. The health department is here giving out flu shots. We have the fire department of San Antonio is here with an ambulance, so that way you can actually walk through an ambulance and see what you would face if you ever had to be a patient in an ambulance. And then, of course, we have our own Thrive and sepsis booth here.
Yes, and I mentioned that we're at the Thrive booth, which is really about educating the public about life after an ICU stay. We have Vinay with us, who is our council liaison to the Thrive task force. Vinay, could you tell us more about the ongoing activities of Thrive?
Well, Thrive is really part of the transition back to the community. Today's about the community and saving a life, but what we know is that there's a post-intensive care syndrome that patients in the ICU experience, physical, mental, and to try to cope with that, try to deal with that, we're learning more from patients and families how we can help reintegrate back to the community.
So, what advice do you give to patients about seeking help after the ICU stay?
Well, it's not so much about what I, as a critical care provider, would say. It's really about what other people who've gone through that same experience would advise and help them with. So what we do is we now bring our experience, what we know about this post-intensive care syndrome, and we ask patients and families to talk to each other. We bring them together in peer support groups. We have meetings in person or online, and we facilitate people talking to people about what it's like to be in the ICU, their fears, their aspirations, and how they get over those bumps in the road to get back to their regular lives.
as a better way for patients to be able to connect with these types of individuals or these types of services, where should they reach out to?
Well, that's a really good point. It's a connection. This is critical connections, but it's really about them connecting in the way they want to. And how can the society help them? We have Thrive, we have a website that they can go to, we have people that they can talk to, and they can talk to each other because the units that are adopting Thrive are figuring out before they discover that they're having problems, how to ward them off, how to alert them that this might happen. So it's people helping people, patients, families, and providers.
I've heard about Thrive Collaboratives, and what exactly does that entail?
Well, Thrive Collaboratives are really these groups of peer support groups and individuals who are getting together to try to solve this problem of post-intensive care syndrome. The things that people experience in and during critical illness, it pervades, it persists afterwards. It could be something physical, it could be something mental, could be depression, any number of things. But there are ways to get around that. There are ways to improve and to accelerate the process of recovery so that people don't just survive, they thrive.
Thank you so much for sharing with us about Thrive. I know today was our outreach to the public to educate them about Thrive, and Amy has been working here at the booth for Thrive. Could you tell us what some of the questions that you've received from the public concerning Thrive?
Yeah, we've actually had a lot of community members come through our booth today just wanting to understand sepsis and what are the general signs and symptoms and the definition of sepsis. In fact, we had 2 caregivers come by that were concerned that they weren't going to be able to identify sepsis in their loved ones, and we were able to educate them on some of the symptoms that might enable them to seek medical care should their loved one have those symptoms.
Great. I also know that you are on the program committee for this year's Congress. Could you tell us about some exciting events that would be coming up here in Congress?
A lot of events this year surrounding Thrive and PICS. We have a plenary session that will be talking about brain dysfunction after infection, as well as a lot of concurrent sessions helping clinicians to detect and perhaps treat PICS.
I'm looking forward to a great Congress. Thank you, Amy.
Thank you.